The winter season is here, and especially for the Canadians who are facing the polar vortex these days, in which the temperature is going between minus 25 to minus 55 degrees. This is because the harsh, cold, anti-clockwise winds coming from the poles are trapped in the atmosphere. So with this winter come the normal winter health problems, normally related to the respiratory system or the frostbite problems. But this season, there is an increased surge of the Novovirus infection over there. And the doctors are highly concerned, especially for the children, the elderly, and those with a reduced immunity level who may be infected by this highly contagious virus. This causes diarrhea and vomiting, and there may be stomachache, there may be nausea. Sometimes the people also have fever and headache and body aches along with it. This is the leading cause of diarrhea and vomiting even in the US, and in UK also there are 600,000 to 1 million cases of Novovirus every year. In our parts of the world, although the numbers are not known, but the stomach flu definitely exists all through the year with increased cases during winter. So, what can we do about it? The symptoms we have talked about. So, how does it reach the people? How does it spread? It spreads by the orophycal route. So, whenever a person who is having the infection is in close proximity, and the people who are taking care and handling those people may get infected by sharing the food, by sharing the utensils, or sharing the different items. Then the different surfaces that are contaminated by the virus, when we touch those surfaces and then we don't wash our hands and the hands go into our mouth for any reason, then the virus can reach to you. And similarly, if the people are handling the food, who are infected are handling the food, then they can contaminate the food and water, and those who will be using it, who will be eating it, who will be drinking it can get infected. Viral infections normally do not need any specific treatment. All we need to do is take plenty of rest, take lots of fluids, and if there are different symptoms of fever and pain and vomiting and nausea, then those medicines will be advised by the doctor. You have to be very careful that the fluid level in the body is maintained, because dehydration can occur because of excessive vomiting and diarrhea. How do you recognize dehydration? If the fluid level in the body is less, then there will be decreased urination, or the urine may become very dark in color. Then especially for children, if they are crying, there will be no tears, or very, very little tears will be formed. The person may feel dizzy, they may feel irritated, they may feel there may be lack of alertness, and there can be increased sleepiness. If these symptoms are there, rush the person to the doctor so that their fluid levels and electrolyte levels can be maintained. Now, it is a contagious disease. The virus, the symptoms may go away in 1 to 3 days, but the person is still shedding the virus for another 5 to 15 days. So please be careful. Do not expose others to the virus unnecessarily. Now, what is the treatment? We talked, there is no specific treatment. So rest, fluids are your mainstay, and a good diet. Now, how can you prevent the spread of the virus? These are the things which are in your hand. Wash your hands, especially after going to the washroom. We know the way of washing is to wet the hands, put the soap, and then rub it nicely all around, everywhere, in between the fingers, clean under the nails. Use this for at least 20 seconds. Do this and then wash your hands under clean water. Then wash your vegetables and fruits nicely. Cook the food properly, especially the seafood and the shellfish. They carry the Novovirus quite a lot. So cook your food nicely. Then personal hygiene we have to maintain, and plus the hygiene of the areas around us, of the different surfaces around us, they have to be maintained. You have to use the different disinfectants. So all the surfaces are clean. Then the laundry of these people who are infected, it has to be handled with care. It should be washed, and then it should be boiled to sterilize it, to kill the germs. And then you have to stay at home for at least 48 hours after your symptoms have subsided, so that you don't give it to the others. So take care, stay safe, enjoy the winters, and fight the stomach flu. Assalamu alaikum. I'm Dr. Mariam Ati.